Hi, my name is Jared Carter. I'm a physical therapist and I'm going to be showing you a self-release for the psoas muscle, which is one of our primary hip flexors. It runs from the front of the hip to the front of the lumbar spine and is very involved in a lot of different back pain issues. This is just a video for Carter Physiotherapy patients. I wouldn't just tell anyone who've not seen us and had this directly prescribed to be pushing into the guts and into the stomach in this way. So if I've given you this exercise, or if we've given you this exercise, this is how it goes. Essentially, this is a pressure inhibition style of technique where you're pressing and holding on the psoas until it relaxes. And you're going to do that in a relaxed state, i.e. laying on your stomach. So what you're going to do is you find your belly button and then the front point of the hip bone, the kind of most pointy part of your pelvic bone, and you imagine there's a line between the two. You want the ball to be right on the middle of that line, not too low, especially if you're a woman. You go a little too low, you're going to be pushing on your ovaries. So think about the line, the belly button to the front point of the pelvis, right there. Place the ball and then ease down into it. Now if that hurts right away, you're just going to breathe into it. You might have a pillow underneath the chest and something underneath the ankles, so you can really just relax and breathe into it until the pain subsides. Now if the pain never really subsides, then that's all you really need to do. But let's say you start to do this over time, and it's not as painful anymore. Then you're going to start to use some leg movements in order to further release and really get into the psoas. So first, you're going to do knee bends up and down. Do about 10 of those. Then you're going to be dropping the foot in and out, again about 10 times. And then finally, you're going to put your toes down on the ground and extend the knees straight. Now, this is not something you typically do on a bed because usually it's going to sink in too much. If you only have a bed to work on and you don't want to do it on the ground, or it's a problem to get down on the ground and back up, you can use a thin book underneath the ball so that it has something firm to push against. So those are the main movements that you would add. So you're doing after the knee extension, and if you need further depth of push on the ball, you can frog leg out, kind of kick out the other opposite side, out to the side like that, and then go through those same movements, 10 repetitions of each. Now the next thing I usually will have everyone follow this exercise with is a relaxed stretch, a lengthening of the psoas muscle. It's something I call the scissor stretch, and you'll see why in a second. Essentially, the side that you just did is going to be the side that's up. You're going to lay on your bed at home, and you're going to get your body as far onto the bed as possible so that you're not working this leg hard to keep from falling off. You're just kind of relaxed on the bed like this. Again, you might have a pillow here and something underneath your other ankle. And this leg is just hanging off, knee bent, just mostly relaxed, right? Now, if you have any pinching in the low back with this, then come all the way down flat, like this. If that still pinches in the low back or causes pain, you can slide this leg out a little bit. But if possible, get the leg up high and start out on your elbows. Again, if there's any pinching, you just lay flat. Now, as you do this over time, as instructed by me or the therapist at Carter Physiotherapy, we might also want you to come up to your hands, but making sure that as you do that, you're not lifting your whole pelvis. The pelvis still needs to be down on the mat for this to work. But again, you're avoiding any pinching back here. And what we're doing is we're lengthening in a very relaxed manner the psoas on the side that's up. So this is really important to know. A lot of people doing this stretch won't feel a stretch and they'll think this isn't doing anything. But actually, the point of this is that we lengthen the muscle in a very relaxed state. So that's, in that way, it's different than what you'll see some people do, which is hanging the leg off, right? But then if there's a pain or a problem, the muscle's having to contract to keep the leg from falling further down, which is not what we want. We want it to be in a really relaxed state to really truly lengthen in a comfortable manner. Another one you'll often see people do for this muscle, and I'm not saying this is a bad thing to do, not a good thing to do before working out, but if you're really trying to get a true lengthening of the tissues that last, then doing something like this where the muscle you're stretching is going to be contracting in order to keep you from going into the splits is not the best way to do so. This is more of a stretch that you would do in order to just warm up the tissues before a workout. Okay, so that is the psoas hip flexor muscle self-release technique, followed by the relaxed scissor stretch lengthening of the psoas.